Hello everyone, welcome to my GMB News channel. I hope everyone is having a wonderful day. Before we begin, please hit the subscribe button and give this video a thumbs up. Keir Starmer has brought the health service back under the control of ministers by abolishing NHS England. The Prime Minister said the NHS should be overseen by politicians rather than an arm's-length body. Starmer's move is one step towards reversing a shake-up of the NHS carried out by former Health Secretary Andrew Lansley in the first years of the Conservative Liberal Democrat coalition. In a speech about reshaping the state, Starmer said NHS England would be abolished to cut bureaucracy and bring management of the health service back into democratic control. He said the move would free up cash for doctors, nurses and frontline services, and cut red tape to help speed up improvements in the NHS, with the government aiming to slash waiting lists by the next election. Wes Streeting, the Health Secretary, has already presided over plans to reduce the size of NHS England by half, and its chief executive, Amanda Pritchard, is leaving at the end of the month. Streeting said on Thursday that the government was abolishing the biggest quango in the world by getting rid of NHS England. Its functions would be taken into the Department of Health. Chapter 1. A Vision for Change. Keir Starmer stood at the podium in Downing Street, facing the cameras with a resolute expression. The British public had been waiting for this moment. The Prime Minister's announcement was not just another policy change. It was a declaration of intent, a reversal of over a decade of NHS governance by an arm's-length body. "We are taking back control of our National Health Service," Starmer declared. "For too long, bureaucracy has stifled progress and responsibility has been diluted. Today we begin the process of bringing the NHS back under democratic control." The decision to abolish NHS England had been a long time coming. Starmer's Labour government had campaigned on a promise to revitalise public services, and nowhere was reform more urgent than in healthcare. The waiting lists had ballooned, hospital staff were overworked, and patients were growing increasingly frustrated. In his speech, Starmer laid out his rationale. The NHS should not be managed by an unelected quango but by the government you elected. It should be answerable to ministers, to Parliament and ultimately to you, the British people. The move was aimed at cutting bureaucracy, redirecting funds to frontline services, and accelerating much-needed improvements. It was also, as critics argued, a political gamble. Chapter 2. The End of NHS England. The formal abolition of NHS England was not an overnight decision. It required months of planning, delicate negotiations and political maneuvering. Wes Streeting, the Health Secretary, was at the forefront of the transition. His first step had been a dramatic downsizing of NHS England's administrative structure. The organisation, once the world's largest quango, was now a shadow of its former self. Chief Executive Amanda Pritchard had already announced her departure, recognizing that the writing was on the wall. Streeting faced fierce opposition from some quarters. Health policy experts warned that dismantling NHS England could create chaos in the short term. But the Health Secretary was unwavering. For too long, NHS England has operated as a separate entity, often resisting ministerial direction. "We need a system that is accountable and responsive, not one that hides behind layers of management." The functions of NHS England were absorbed into the Department of Health. A new ministerial oversight board was created to ensure direct political accountability. Senior civil servants and healthcare experts were brought in to oversee the transition, but the ultimate power now rested with elected officials. Chapter 3. Rebuilding Public Trust. One of the primary goals of the reform was to restore faith in the NHS. In recent years, public confidence had waned as waiting times soared and patient experiences deteriorated. A major component of the restructuring was the reinvestment of funds into frontline services. The government announced a £10 billion package aimed at recruiting new doctors and nurses, increasing hospital capacity and improving emergency care services. At the Royal London Hospital, Nurse Sarah Mitchell was cautiously optimistic. "If this means more staff on the wards and better conditions for patients, then it's a step in the right direction. But we've heard big promises before. We need to see real change." The government also pledged to cut red tape. Under the previous system, local NHS trusts often found themselves caught in bureaucratic deadlock, delaying crucial decisions. The new structure was designed to give hospitals and GPs greater autonomy while keeping ultimate accountability with the government. Chapter 4. The Political Battle. Not everyone welcomed the reforms. The Conservative opposition accused Starmer of centralizing power and eroding the independence of healthcare management. Former Health Secretary Jeremy Hunt warned that political interference in day-to-day NHS operations could lead to short-term decision-making driven by electoral cycles rather than long-term patient care. The NHS needs stability, not more upheaval, Hunt argued in the Commons. Starmer's plan risks turning our health service into a political football. But Labour MPs rallied behind their leader. Angela Rayner, the Deputy Prime Minister, dismissed the criticisms as fear-mongering. What's the alternative? An unaccountable, faceless bureaucracy? The NHS belongs to the people and it should be run in their interest. Chapter 5. The First Test. As the transition progressed, the real test came in the form of patient outcomes. Starmer had promised that waiting lists would fall, but could his government deliver? Early indicators were mixed. Some hospitals reported faster decision-making and improved coordination between departments. However, others struggled with the rapid changes, facing disruptions as responsibilities shifted from NHS England to the Department of Health. Dr. Raj Patel, a GP in Manchester, was skeptical but willing to give the new system a chance. If this streamlines services and makes sure money is spent wisely, then I'm all for it. But if it becomes just another layer of bureaucracy, then it's a waste of time. Chapter 6. A New NHS? 6 months after the abolition of NHS England, the government released its first review of the reforms. The findings were encouraging. Waiting times for routine procedures had decreased, recruitment of medical professionals was up, and hospital efficiency had improved in several key areas. However, challenges remained. The sheer scale of the restructuring meant that some regions adapted better than others. There were concerns about political meddling in clinical decisions, and unions continued to push for greater worker protections. Despite these hurdles, Starmer remained steadfast. We have begun the journey to restore the NHS to its founding principles. This is not about control for control's sake. It is about accountability, efficiency, and ensuring that every patient receives the best possible care. Epilogue. The verdict. As the next general election loomed, Starmer's gamble on the NHS was shaping up to be a defining issue. His government had taken a bold step, one that could either cement Labour's legacy as saviors of the health service or burden them with accusations of overreach. For the doctors, nurses, and patients on the ground, the only thing that mattered was whether the system worked. If the NHS truly became faster, fairer, and more efficient, then Starmer's radical shakeup would be remembered as a turning point. If not, it would be yet another chapter in the long and troubled history of British healthcare reform. Only time would tell. So what do you guys think about this update? Let me know in the comments below. And if you like my videos, please press like and subscribe for more. I'll see you guys next time.